Продовжуємо роботу в Україні.
We continue our work in the UCMC, and now we'll be talking about health without compromise. Ministry of Health of Ukraine bans the use of asbestos and products from it. Our speakers are Oksana Syvak, Deputy Minister on Public Health and European Integration, Olga Tsyguleva, Coordinator of the Program on Chemical Safety of the MAMA 86 NGO, and Oleksii Shumilo, Head of Kharkiv City NGO, EcoPravo-Kharkiv. You're welcome. Good afternoon to everyone. Thank you for this opportunity to discuss such an issue. Health without compromise is our credo today and always. International Agency on examining the cancer recognized that approximately 100,000 people die in the world because of the use of asbestos. The Ministry of Health should keep as a priority the health of our people. The order that bans the use of asbestos and products from it is really very important for the health of our population. Ukraine is now developing in the direction of European legislation, and we have the commitment to harmonize our legislation with the European one, and the directives of the Council of Europe from November 2010 on protection of the workers from the influence of asbestos at the working place. We are working on implementing this directive, but I would like to emphasize that our priority is the health of our population. I would like to mention that when we are talking about jobs, we don't need to reduce the number of jobs. We need to prohibit the use of asbestos. There are the admixtures which could replace this cancerous product. And I would like to emphasize one more thing, that the MOH does not ban the import of asbestos, does not require to close the companies, the businesses, and to reduce the number of jobs, but introduces European mechanisms to create conditions to reduce the diseases which are caused by asbestos. We are actively working in cooperation with the Ministry of Economy. On Friday we had very good meeting, and that was led by the first Vice Prime Minister Kubiv. There was the meeting of the Association of Producers, and I believe we managed to explain the risks which exist for our population. Now the issue is who can change, who cannot change. In Ukraine we have 7 of such companies. Many others, they switched to other admixtures. This is not a big problem. And mentioning the figures, one sheet of roofing which is made of asbestos costs 110 hryvnias. We took that from the internet. I could be mistaken. Without asbestos, 135. The difference in price is 25 hryvnias. Once we are talking about the health, treating the cancer of lungs. Basically, the health should be the priority. What will be happening with this order, it will be implemented, but we need to take into account all the legal aspects, including the producers, so that they have time to switch to other mixes. The Vice Prime Minister made instructed to examine this issue. Basically, people are taking care of their health, and even without our orders, knowing that that's dangerous, they buy roofing without asbestos. But in the east of Ukraine, there's bombing, the war is going on, and they have to replace the roofing every day, and the issue is how quickly they can replace it. And we understand that no one will be removing this roofing. The order does not require to replace the roofing. We do not say that we need to demolish old houses, but we recommend, according to the sanitary norms and rules, that this is dangerous for the health of our population. And that's the idea of the Ministry of Health, the health without compromise. Then the economists and lawyers have to gradually move to the process so that they understand that all, but people should understand what is the risk for their health. That's dangerous, and
Да, статистики це дуже багато. Тобто ціна питання.
Talking about statistics, it's a lot. I thank you. I can answer your questions. Here are my colleagues, and here's the lawyer who will answer your questions in a qualified manner. Maybe we can switch to questions.
Вашу цікавість, я трошки...
Thank you for your interest. I will describe in brief details the environmental negative impact and negative implications for health. I also will remind some statistics about general picture in situation with health. The asbestos has become the focus of attention of Rotterdam Convention some 10 years ago, and some lobby supporting its production, including our neighbors Kazakhstan and Russia. We do not have production of asbestos in Ukraine. We do not produce asbestos. We just buy it from Russia and Kazakhstan. That is, we buy it just like materials, like supplies, and we can simply change supplier, and that's it. For some period of time, Ukraine also belonged to that small group of lobbyists which promoted asbestos production and opposed ratification of the Rotterdam Convention. But last year, Ukraine had formulated its strict position that we won't oppose inclusion of the asbestos, this harmful asbestos, to the list of prohibited compounds any longer. I would like to mention also that some particles of that asbestos may happen in the air. They are quite often in the places where our cars, where we use brakes of our cars, because these compounds are used in materials used in the cars. That's why we do not advise people to stay longer in the crossroads where a lot of cars use brakes to stop. So the next issue is what to do with the stocks of the asbestos which are already procured. The working group, which was thinking about this, had prepared some recommendations. I think that recommendations are quite helpful, and we can implement them. The NGO and healthcare organizations which deal with the security issues, quite often they used to say that since you do not have any data, then you cannot say that this or that materials are harmful for human health. But I do not think that that's right approach. When we try to involve more stakeholders like NGOs, they're ready to provide proper data reflecting that the materials which are part of the roof slate, they can make real harm for human health. Now I would like to give the floor to my colleague who will, Oleksii Shumilo, who will describe the international best practices in this area. Thank you very much. I'm very much grateful for invitation to this conference, and I'm very grateful to the Ministry of Health, which had made this useful attempt to issue the resolution. And I hope that this order, which will come to force in 6 months, will improve the situation. Some people, and this is international data, some people sued the companies for harmful impact of asbestos. For example, some time ago, France sued Canada for supplies of asbestos, while Canada claimed that the World Trade Organization had no limits. But since 2005, the use of any materials containing asbestos are prohibited in all the EU countries. What to do with that asbestos, which we already have in Ukraine, like roofs, like fences, like other constructions, light constructions made of asbestos? Well, the Polish experience was as follows. The city councils, municipality councils suggest to disassemble that constructions on the account of the municipality, and they bury that materials that disposed materials in old depleted mines, and then as the owner of the construction, you just have to pay for new roof or for new fence for yourself, etc. When we'll look at Russia, well, in Russia, there are advisors to crash the used asbestos, and in order to make hard surface for your ground, which you have in your vegetable garden, to have harder way during rain. This shows how unfamiliar people are with this harmful impact of asbestos upon human health and environment. And there are now 2 cases in court, one in Zaporizhia, another in Chernivtsi, when ordinary citizens sued the municipalities for harmful impact of fences. So and the judges were not familiar with the environmental legislation, with the EU legislation, so they ruled out that, of course, the installation of such fence, it is a violation of regulations. We do not, as asbestos is allowed as construction material in Ukraine, but let us make that fence lower. So the judge made a decision to cut that fence in order to release more asbestos into the air. And you can find this in court decision, and thus this court ruling demonstrates that that judge was totally unfamiliar with harmful effect of asbestos endangering health, human health and human life. When we look at the employees who work in that harmful productions where asbestos is used as one of the production materials, what we have found out that their experts say that employees say that during 25 years they had no cases of lung cancer among their employees, and of course I reviewed court decisions, court practice, and I haven't found it, but there is a case when docker in Ilichivsk port who worked on reloading of asbestos from ships, took a lot of asbestos, died because of that illness, of that disease which he acquired due to his work. And
the docker who works in the port got sick because of asbestos, and people who work in the plant somehow, I don't know. There are some legal issues. We will not say that the person could be sick for 4 months only. The latent period could last for several years. So the person might have bronchitis. In 4 months, he receives disability. What happens to the person later, the company is not interested in that. And they say that they don't have a single case that a person dies because of that. And in the end, I would like to say that the European Court on Human Rights, in its practice, I take 2 cases versus Malta versus Switzerland. Such cases go to European Court. The European Court mentions that the states have to indicate that asbestos is harmful. They have to warn about that, and they have to pass laws. For Ukraine, as the country that ratified the European Convention on Human Rights, for us the ruling of the European Court on Human Rights is the source of law. I can talk about that for long, so now if you have questions, you're welcome. Now let's move to questions. Please introduce yourself. 1+1. You mentioned several times that the order does not prohibit, but you didn't say from which date the asbestos cannot be used is banned. I mean, I believe that that's not just for roof slates, but what other companies have to implement this order? If they don't implement this order, are there any sanctions? And do we have any statistical data on how many people are sick because of asbestos? I will try to remember all the questions. First of all, the title of the order. The order is on approving sanitary norms and rules on security and protection of workers from harmful influence of asbestos. It is basically protecting the health of the population. The producers, all producers, have to follow the rules. We concentrated our attention on roof slates because that's what we know. But if the plant is working, they receive some license and they indicate whether that corresponds to the sanitary rules or not. As to who should implement it, everyone should. On Friday, at the meeting with the Ministry of Economy, where the producers were present, we approved the period of 6 months. People need time to switch. Now there are discussions going on about how long should the transition period be, 6 months or more. We will inform you later, but it's better to ask the Ministry of Economy. We do have the full support of the Ministry of Economy, but now we need to have it agreed with the producers. But that's not our level because the ministry takes care of the health of the population. As to the statistics on diseases, we don't have the statistics. The oncological diseases are very widespread in Ukraine, but unfortunately we don't have clear statistical data on what factor influenced it. We don't have it, and our patients, our population, they go for treatment, but when the person gets sick, they do not go to court. So we need to work with people and producers. If we understand that asbestos is very harmful, then if you buy something and it's not just asbestos, there are different harmful admixtures which are components of some products. We're talking about prevention. When a person gets sick, it's too late. You need to take care of your health. And no one but you can take care of it. The Ministry of Health will provide recommendations and will provide treatment. But believe me, we need to protect our health ourselves. As to asbestos, pay attention to the composition, to the ingredients. If in 6 months, on the 26th of December, everyone should refuse from asbestos, will someone check it? Or maybe it's easier to prohibit export into Ukraine. Basically, there's an order, but who will? Why I emphasize that we do not prohibit, that's not the function of the Ministry of Health. Every ministry should execute its function based on this order. So other ministries should issue their orders and should follow that. As to export, I would like to add, because Ukraine is the party to Rotterdam Convention, which has the principles of the grounded agreement, consent. And if the asbestos becomes part of the list on the Rotterdam Convention, then we can demand that the government of Ukraine passes the resolution which prohibits the export of asbestos from import of asbestos from Kazakhstan and Russia.
Юридичних важелів для того, щоб це зробити. Це може бути, може, захищаючи себе, своїх громадян, здоров'я громадян, просто заборонити експорт хризотилу, не посилаючись на правила Роттердамської конвенції. Дякую.
As to agreement, there are some problems. We have the law on environmental impact assessment. First, the president didn't sign it, then signed it. There is Article 3 there, you can look it up, which provides for the first category of types of activities which are to be assessed, the activities on production and processing of asbestos and so on. The order, you're right saying that the order of the Ministry of Health prohibits the use of asbestos in production, but a different law, which is recent law,
передбачає виробництво асбесту, але тут є певна нестиковка. Тому ми над тим будемо працювати і показувати те, що якщо ми забороняємо, то забороняємо повністю. Так, як в Європі. І асоціація якраз є, як Європа, ще раз нагадаю, з 1 січня 2005 року.
From January 2000.
Шановні колеги, на жаль, на час в прямому ефірі вже не залишається запитань, тому що зараз брифінг полковника Лисенка, речника Міноборони з питань.
We don't have any more time for questions, so please ask your questions off records. Thank you for understanding.